So Kentucky's in really pretty good shape when you look at all the other states across the country. The social distancing and the early social distancing and the restrictions that have been in place have had a very positive impact. We are in better shape than many states in the country. I know we have many more folks who've become unemployed and who have not been able to go to work, but there are supports available. You hear every day about unemployment insurance, but what you don't hear about are the other resources that are available. Medicaid, we call that getting health care coverage. SNAP, which is assistance with food. And there's a number to call, if I might, 855-306-8959. And that's how people can apply or get on to talk to somebody about how to apply for Medicaid. There's another, you can go on the kycovid19.ky.gov website and look for benefits, and that'll also take you to a place where you can sign up for Medicaid. Medicaid is how to pay for health insurance, and I like how to pay for health care. And what I like to say is that's how we support our hospitals. That's how we support our healthcare workers, because we can get them paid because you have healthcare coverage. So it's not a selfish thing to sign up for Medicaid. It is something that actually helps our healthcare system. The same for what we call SNAP, formerly known as food stamps, right? That supports our grocers, right? It helps you get food, but it's not in any way selfish. And people are sometimes a little nervous about accepting help. But when you think about it, who you're helping are the folks in your community, your hospitals, your healthcare workers, your grocers. Those are the folks that you're helping when you have the ability to go and buy things from them, buy healthcare services from them, buy food and groceries from them. Those are things that you support them with.
Keeping the economy going. So that phone number that you gave, the 855-306-8959, is, we're hearing so much about people sitting on hold for hours on end. Has the state hired more operators to assist you?
Not on these lines. We have an average wait time of under 10 seconds right now, and we are answering all the calls that come in. So these are we've done this, came in and a lot of these systems were broken, and actually we'd started to fix them in the several months that led up to this, and I'm very glad we did, because now I can tell you, we moved people home and we are more efficient at answering the phones than we have ever been. We're answering about 10,000 calls a day, and we have Saturday hours, 9 to 2. So folks can call in, and the experience, I think, and I've talked to folks who actually call the lines and they say they're really working well. So on these, the Medicaid, the SNAP pieces, it's working very well. And may I take just one more second?
Yeah.
Okay. So in this time with economic uncertainty, all the uncertainty that we have out there is the time that folks sometimes, if they're in recovery, it's a challenge to that. Folks in long-term recovery for substance use, it's a huge challenge, and we see it. We maybe are seeing some increase in overdose deaths right now, and we know this is the kind of perfect mix of when folks fall out of recovery. So there's another number. It is 833-859-4357. That's where you can get help now. And so if you call that number, or you have family members that you think could benefit from that, call. We've made a lot of changes to make substance use treatment more available to folks. This is the time not to lose your recovery. It's also the time, if you have, or if you haven't started recovery, this is the time to start. So I encourage folks, if you're having trouble, call that number.
And in this global pandemic, there are a lot of people who are having trouble. That is Eric Friedlander, who is the Secretary of the Kentucky Cabinet for Health and Family Services, joining us via Zoom here on Coffee Near Me. I'm Barbara Deeb, coming to you from my dining room. Remember, you can keep the conversation going. Who would you like to sit down and have a cup of coffee with? Secretary Friedlander, thank you for your time. I know you're very busy, and let's all stay well. What do you say? Cheers?
Stay well and cheers. Thank you.